Thank you for being with us, Dr. Odenheimer. We have a couple of questions, but we're going to just let you speak from your heart and your mind about these things. Let me just toss one out and we'll get the discussion going. Could you please speak with us a little bit about how to help or hinder communication with individuals who have Alzheimer's disease or other dementias?
Yes. I think that some of the core things are the approach to the person and treating them as if they are still human beings. I think that you need to address them from the front. You don't need to surprise them. You need to not give them too much information at once. Allow them to take in what information you've given them and then move on. I think one of the big issues in facilities is that they're rushed. They're trying to get a lot done, and that carries over to their attempts to communicate efficiently and quickly. And in fact, what ends up happening is that the patient or the resident becomes more agitated and more resistive to care. And so what they think is being efficient turns out to be inefficient.
Right, that's very helpful. You were describing some mechanisms or some approaches that would address possible confusion in an individual who might not recognize who you are or what your intentions are. Does that sound right?
Sure. In fact, I mean, for the staff, that's particularly important, but even family, at some point, the person may not recognize them anymore. So what the person will usually continue to key in on, though, is how you connect with them. And so you can introduce yourself every time you see them because they may not remember. But beyond that, you have to realize that they're picking up on your emotions and your eye contact and your gentleness and your respect. And those are the things that allow you to communicate more effectively. So whether they know you or not, they may know that they like you or don't like you, and those will make a difference.